survey after survey and poll after poll shows that ever-increasing majorities of Americans support a single-payer solution as well. I don't know how many of you have read this book. Yeah, The Audacity of Hope by our president. On page 177 he writes, "The bigger the pool of insured, the more risk is spread, the more coverage provided and the lower the cost. Sometimes though, we can't buy insurance for certain risks on the marketplace, usually because companies find it unprofitable. Sometimes the insurance we get through our job isn't enough, and we can't afford to buy more on our own. Sometimes an unexpected tragedy strikes, and it turns out we didn't have enough insurance. For all these reasons, we ask the government to step in and create an insurance pool for us, a pool that includes all of the American people. Mr. President, only a Medicare for all single-payer system can provide a pool that includes all of the American people." We've heard time and time again from the apologists for the for-profit insurance industry that a government-run system would be un-American, smacks of Western European socialism. It would not be as efficient as the private sector. While CAPA and PNHP believe in evidence-based healthcare reform, not lies and distortions. Actually, in healthcare, government is far more efficient than the private sector. Why else would the insurance companies be so opposed to a single-payer system or to a robust and fully capable public plan option? And as far as being un-American, well, we have our own homegrown single-payer system right here in America. Yeah. It's called Medicare, and it works very well, thank you. We just want to expand it to cover all of us.
Thank you all for coming.
He must have known.
I'm a big fan of the USC Trojans.
Yeah!
I'm a fan of the 49ers. I'm a Giants fan. But I'm a bigger fan of HR 676. As a 9/11 survivor who couldn't get health care, because in this country if you're chronically ill, you're expected to die silently, I traveled to Cuba to obtain a 5-cent inhaler, where before I traded my food money to be able to get health care.
There's a very exciting new project that we were announcing today. There are a series of public service announcements that have been made, and they're shown in the booth down there on the white. They feature our next speaker, and you can go watch that short spot and send a fax to the White House today. So after the rally, please be sure to do that. It is now my pleasure to introduce a longtime activist for social and economic justice, a proud supporter of single-payer health care. You know him as BJ Honeycutt from MASH, Mike Farrell.
Thank you and hello and good morning. I'm pleased to be here with you, and I'm sorry that you're out here and they're in there. You know, it's sort of a joke to say I played a doctor on television, so I know something about healthcare. So I don't claim to know something about healthcare. I am an advocate for human rights, but I understand that healthcare in this country is and ought to be a human right. As we understand it in this country, there are certain fundamental things that belong to the people. This healthcare is one of them. We should get the profit motive out of the healthcare system, and we do that by establishing something that seems to be unspoken inside, and that is single payer. I don't understand, I must say, I don't understand why the debate is being cut off. I don't understand why Dr. J had his piece at the Iowa conference eliminated from the videotape. I don't understand why it is so impossible for people to accept the fact that all of us deserve to have a healthcare system that works for all of us. And Medicare for all, for example, everybody in and nobody out, is something that makes sense to me. So I appreciate your being here.
guess what we call that? We call that a Trojan horse. It looks like reform, but it isn't reform. And we happen to bring a Trojan horse here today. Yeah! And here he comes. Here comes the Trojan horse. I know we got some SC fans here, but let me tell you, this is nothing to cheer about. This is mandated private insurance. You pay for it, and you bail out the insurance industry. That's their idea of reform. What do we say to that? No way! And so here's their Trojan horse. They call it real reform, but it isn't. It's just another tax subsidy to bail out the private health insurance industry.
Insurance companies are getting away with murder. Every time insurance companies deny, guess what? By the end of the day, they make money. And their CEO makes billions and billions of dollars every year. And let me tell you something else. Around Christmas, when my daughter passed away, he makes $3 million as a bonus. Why? Why can't we say? When insurance companies want to get rid of you, they will call every doctor's request experimental. Insurance companies have our lives in their own hands. Look out, everyone. Make a wise decision. This is for our president also. Make a wise decision, please. Look at HR 676. Give the American people a chance to live. Our daughter, Nataline, will not come back. But I know I'm gonna make a change in this world. I'm gonna fly on her wings from state to state, from country to country, to talk about healthcare, to be on every American side, to save a life. And I'm gonna do it.